Hi, I'm Lainey Ortegon.
Hi, I'm Sophie Holmes.
Hi, I'm Renee Garza.
Hi, I'm Melissa Cisneros.
We are in Mr. Domain's 1A anatomy class.
Today we're going to be demonstrating the 17 types of muscle movement.
For abduction, the selected muscle is the shoulder. The muscles involved are the trapezius, deltoid, and latissimus. The agonist is the trapezius, the antagonist is the latissimus. This goes along the frontal plane, and the action that Renee is doing is putting on a sweater. For adduction, the muscle involved is the shoulder. Other muscles involved are the trapezius, triceps, biceps, and the deltoid. The agonist are the triceps, the antagonist are the biceps. This happens along the frontal plane, and the action is Renee taking off a sweater. For circumduction, the selected joint is the shoulder. The muscles involved are the scapular portion of the deltoid, infraspinatus, latissimus dorsi, subscapularis, triceps long head, triceps lateral head. The agonist is the deltoid. The antagonist are the triceps. This involves multiplanar movement, and the real-world instance is Renee driving. For dorsiflexion, the selected joint is the ankle. The muscles involved are the soleus, the gastrocnemius. The agonist is the tibialis and the antagonist is the soleus. This happens along the sagittal plane, and the real-life instance is Alyssa walking. For eversion, the selected joint is the ankle. The involved muscles are the gastrocnemius, tibialis anterior, peroneus longus, and the flexor hallucis longus. The agonist is the soleus, the antagonist is the tibialis posterior. This happens along the frontal plane, and the action taken is Alyssa twisting her ankle. For plantar flexion, we are using the ankle. The involved muscles are the gastrocnemius, soleus, tibialis posterior. The agonist is the gastrocnemius. The antagonist is the tibialis anterior. This happens along the transverse plane, and the action is Sophie tippy-toeing to get something from the top shelf. For pronation, we use the joint of the foot. The involved muscles are the gluteus maximus, tensor fascia latae, and the iliotibial band. The antagonist is a tibialis posterior. This action is multiplanar, and the action is walking and landing on your foot on impact. For radial deviation, we are using the wrist. The involved muscles are the abductor pollicis longus, extensor carpi radialis longus. The agonist is the flexor carpi radialis, and the antagonist is the ulnar deviators. This happens amongst the frontal plane, and this happens when you wave at a friend. For supination, we are using the joint of the foot. The involved muscle is the tibialis anterior. This is multiplanar, and this happens when you are walking, trip over a shoe, and your foot faces the outer edge of your feet. For ulnar deviation, we are using the wrist. The involved muscles are the flexor carpi ulnaris, extensor carpi ulnaris. The agonist is the extensor carpi ulnaris, and the antagonist is the radial deviators. We use the frontal plane, and this happens when you are turning a round doorknob clockwise with the right hand or counterclockwise with your left hand. For extension, we use the knee joint. The involved muscles are the quadricep, the hamstring, and the rectus femoris. The agonist is the hamstring, and the antagonist is the quadriceps. We use the sagittal plane, and this occurs when you are kicking someone with your leg forward. For flexion, we use the knee. The involved muscles are the quadriceps, the hamstring, the soleus, and the gastrocnemius. The agonist is the quadriceps, and the antagonist is the hamstrings. This happens among the sagittal plane, and the action is kicking with your legs back. For hyperextension, we have the neck. Some included muscles are levator scapulae, upper trapezius, sternocleidomastoid, sternocleidomastoid, omoioid, splenoid capitis, and scalenes. The agonist is the omoioid, and the antagonist is the trapezius. and the action is looking at the ceiling. For inversion, we have the ankle or the foot. Some muscles that are involved are the tibialis anterior, the agonist is the soleus, and the antagonist is the tibialis posterior. This happens along the sagittal plane, and this action is turning your foot towards the midline of the body. For lateral rotation, we will be using the ankle joint. A muscle involved in this is the sartorius. This happens along the sagittal plane, and the action is turning the foot outwards. For opposition, you have the finger joints. The muscles involved are the opponens pollicis. This happens on the sagittal plane, and this motion is used to pinch. And for medial rotation, you use the ankle joint. The muscle involved is the gluteus medius. This happens along the sagittal plane, and you use this to step your foot inward as to rotate the body.
1, 2, 3. Thank you for watching
our video.